Hey all, let's talk about Racecadotril, a widely used medicine to treat acute diarrhea, especially in children. Racecadotril is an antidiarrheal medication that works differently from most others. Instead of slowing down the gut, it reduces the amount of water and electrolytes your intestines release, making the stools less watery. So the dose depends on your child's weight. Only use it as per the doctor's instructions. Generally used from babies over 3 months old. Should not be used in babies under 3 months. Side effects are rare and usually mild if present. Racecadotril is usually safe and effective when used correctly, but always make sure to combine it with ORS and plenty of fluids.